this year's Health Hack, I'm most looking forward to collaborating with the NHS and industry to create some fantastic new ideas and helping people to take those ideas forward.
Well, health hacks are important. I always say to people that there's more innovation than they realise across the NHS. There's enthusiasm, there's excitement, and health hacks are a platform for letting that rip, if you like.
And I'm looking forward today to seeing some of that practical stuff turned into real programs that deliver real benefit to patients and efficiencies in spend in healthcare.
I'm really looking forward to being here today because I'm looking forward to meeting with collaborators, industry partners, people who hopefully have got the skills and expertise to join my team and help me to improve care in the community for women post-birth in pools.
So the pitch I'm really interested in working on today is about making physiotherapy entertaining, about bringing entertainment into physiotherapy, about getting us to do the exercises that the physiotherapists would like us to do, and not making it a chore, but something that we look forward to and compete, perhaps even against each other while we're doing it.
I think understanding the challenges that the local NHS has in order to look at the solutions that we're busy creating and see how they can synergize and to ensure that we don't work in isolation to what the real needs are that are facing healthcare professionals at the moment.
From a government perspective, it authorises the sorts of conversations that we want to see between people working in the NHS and people who don't, particularly industry, all of it structured around a quite informal event, which moves at quite a rapid pace. So it's an exciting and an enjoyable event, and more of this would be great.
If you're attending the Welsh Health Hack this year, the ways that you can get ready are have a really clear idea about what the challenges are that you're trying to fix or to meet, and also an idea about what the offer is to the healthcare system. What capabilities, what new skills, what technologies have you got that you can bring along to help us fix some of the key problems facing our healthcare system in Wales at the moment.